Good morning or good afternoon, everyone, as you're getting logged in here, depending on where you are. I am Angie Grover. I'm co-founder and COO for Metopio, and we're going to get started in just a minute or two. But while we let everyone log on to the webinar, I'm going to launch a poll. We do this because we want to understand what you are most interested in learning today, and so we can tailor our remarks to meet your needs. So if you can, we'll go ahead and launch that poll. And if you'd let us know what you're most interested in learning today, that will help our panelists tailor their remarks and make sure you get what you want out of this webinar. So we'll give that a minute and I'll come back here in about 60 seconds to kick us off, and I'll close this after we do housekeeping. Okay, we have folks continuing to log on. If you're logging on and you see that poll, we're asking what you're interested in learning today. We appreciate you taking your time out to join us. Uh, just a bit of quick housekeeping. For today's webinar, we will have the chat on and we will be managing it. So if you have questions or comments during the presentation, go ahead and put them there. The audience will be muted and we will have time for questions at the end. If we don't get to your question, we will follow up with you, and the slides and the recording will be distributed after today's call. So before I get any farther, if anybody else wants to take the poll, I'm going to end it here in just a second. 3, 2, 1. All right, let's share the results. So for our team on the panel today, really, they're interested in how you're using life expectancy and planning, reporting, and engagement to integrate that with other data sources. Pretty much across the board, we've got a lot of all of the above. So I know that we'll hit on all these key points today. And again, I thank you all for joining us. Um, I would like to take, if you go to the next slide, I just want to take a quick moment to introduce Metopio and say that we are so honored to provide tools and data to the Chicago Department of Public Health so they can pursue their mission to work with communities and partners to create an equitable, safe, resilient, and healthy Chicago. This mission is very relevant to our conversation today because it is guided by the vision that everyone in Chicago should thrive and achieve their optimal health and wellness, with a primary focus on achieving health equity and eliminating Chicago's racial life expectancy gap. And we have some awesome speakers on that exact topic today. So while technology is critical to our work these days, for us at Metopio, it really is about how technology can help our partners share data, empower communities, and enable them to be aligned and have collective impact. So for those of you not familiar with Metopio, on the next slide, we are a community context platform that provides data, analytics, and automation to save you time so you have the bandwidth to do the work that can't or shouldn't be automated. We have partnership with the National Association of City and County Health Officials that offers discounted subscriptions to our suite of tools so that everyone, regardless of the size of your department, can access and take advantage of them. But with that, I want to turn it over to two amazing epidemiologists with the Chicago Department of Public Health. Darlene Nolasco Magana is a senior epidemiologist in the Office of Epidemiology. I got that word down pat at the Chicago Department of Public Health. Darlene's role at CDPH is multidimensional in that they provide epidemiology consultation to internal and external collaborators, direct and manage projects across multiple public health areas, and is the lead epidemiologist for the Chicago Health Atlas. Woo, woo, Darlene, we love that. She also shares a passion of mine, and she likes to travel and go hiking in national parks across the U.S. Bridget Brasil is an epidemiologist, also with CDPH, where she has designed or improved the data flow for multiple surveillance data sets. Bridget led the development of programs included in the CDPH Life Expectancy Toolkit, which we're going to share here with you today, and created the Chicago Health Atlas topic page on life expectancy. This is going to be a great interactive webinar. So I want to encourage you to put questions in the chat as we go along, and I will turn it over to Darlene.
Thanks, Angie, for that great introduction. As Angie said, my name is Darlene Velasco Magana, and along with Bridget Brazel, today we'll be going over life expectancy, what it is, how we calculate it, and how it's a guiding metric for the Chicago Department of Public Health. We also want to thank Dr. Emma Boylan and Nick Prashant for their contributions to this project. Next slide, please. So what is life expectancy and why do we use it as a measurement? Life expectancy is defined as the number of years a person born in a particular year could expect to live if death rates remain the same as they are in that particular year. Life expectancy is an important population health indicator that can be tracked over time and compared between groups at the local, national, or global level to measure the general health of a population. It is a standardized measure that is used to set priorities around common and avoidable causes of death, as well as determining differences in deaths between groups. So life expectancy can be used to compare between race and ethnicity groups, to countries, cities, or even the community areas of Chicago. Next slide, please. Life expectancy has been used as a metric for understanding the health of Chicagoans for years. However, in 2014, the Chicago Department of Public Health utilized life expectancy and specifically the differences in life expectancy by race and ethnicity groups, as well as community areas, to not only understand the health of Chicagoans, but the health inequities experienced by these different groups. And so this was guided by two of Healthy People 2020's foundation health measures of monitoring general health status and disparities. And so this life expectancy analysis was published in a report in June of 2014. And the findings of the life expectancy analysis was used for strategic planning purposes and was one of the overarching indicators of the Healthy Chicago 2.0 improvement plan for the 5-year period of 2016 and 2020. This improvement plan was released in March of 2016. And so for the next community health improvement plan, the Healthy Chicago 2025, released in May of 2020, the life expectancy racial gap, that is the difference in life expectancy in years between Black and white Chicagoans, was a core measurement for informing the city's strategy for improving the health of Black and Latino Chicagoans. And so now jumping forward to December of 2024, for the Healthy Chicago 2025 strategic plan, the life expectancy racial gap continued to be a core measurement. However, the gap was redefined to be between Black and non-Black Chicagoans, and that includes Asian and Pacific Islander, white and Latino Chicagoans. And so one reason for this redefining of the racial gap was to decenter whiteness and reframe how we approach improving the health of Black Chicagoans. And the second reason is based on the continuing trends in that all other race and ethnicity groups have considerably higher life expectancy compared to Black Chicagoans. Next slide, please. So the life expectancy in Chicago 2023 data brief released in September, and now the life expectancy topic page on the Chicago Health Atlas, continues understanding the health of Chicagoans through the Black and non-Black racial life expectancy gap and the causes of death categories contributing to said gap. And so by identifying inequities in life expectancy by demographics, such as race and ethnicity, or geography, including community area or community areas, efforts in these areas can be made to shrink the gap and increase the life expectancy for Black Chicagoans. And so the life expectancy data results were used to inform interventions from the health department as part of the Healthy Chicago 2025 strategic plan. And one example includes the Play Streets intervention that was restructured based on the life expectancy and gap results to have events not necessarily all over the city, but now focused in 8 community areas where chronic disease outcomes could be improved. And so now the initial intention of Play Streets providing a safe space for community gatherings was coupled with chronic disease related focuses such as child and adult physical activities, as well as heart health education. So now I will go ahead and pass it over to Bridget, who will go over how life expectancy is calculated and the life expectancy topic.
Thanks, Darlene. So how is life expectancy calculated? So we use two main methods to calculate the Arriaga or Chang method. And to start in either method, a life table is created first. So we get death and population by age group from death certificate data and US Census data. And then we use that to calculate the probability of dying within a 5-year age range. Actually starting with age at less than a year old, and then 1 through 4, and then subsequent 5-year age ranges. But then we can then estimate the expected years of life remaining in each age range based on the totality of subsequent age groups' probability of dying. And I just point out that the most commonly used in the US is the Chang method with these abridged age groups, 5-year age ranges, with a top age category of 85 plus. And this is actually the method we use for all the data that we have on the Chicago Health Atlas. So I give an example here, or I give two examples here of data from the Health Atlas, but we use it to look at life expectancy by sex, over time, by race, ethnicity, and by community area. And then we can use that to look at trends in these demographics. So we can see that for Black Chicagoans, life expectancy has been historically much lower than all other race, ethnicity, and that in the South and West regions, highlighted in that light blue, life expectancy is much lower than other regions of Chicago. And then there's also the Arriaga methodology. So that allows us to compare two groups and figure out which underlying causes of death are contributing to this difference between the two groups. So one big comparison we look at is Black versus non-Black Chicagoans. And so in 2023, we had found Black Chicagoans had a life expectancy of 71.8 years, compared to non-Black Chicagoans who had a life expectancy of 82.4 years. So that's a 10.6-year difference. And using this methodology, we learned that chronic disease contributed nearly half of that difference in life expectancy, followed by homicide, and then followed by opioid overdose. And so when we use this methodology, we get kind of a list of top drivers to a gap, and we can know from this top cause of death list that it's a cause of death that affects many Chicagoans, but also that it's a cause of death that likely happens to one group much more often than the other, or it happens at much younger ages than the other group. And in a lot of cases, there's a mixture of both occurring. So for most chronic diseases, Black Chicagoans definitely have higher mortality rates overall, but they also tend to die from their chronic disease earlier than non-Black Chicagoans. And then at CDPH, we have a life expectancy toolkit that is available for use for other state and local health departments. It's just on our website there. And it's a set of SAS programs and other files that calculate life expectancy for certain stratifications, so race, sex, or geography, and allows you to compare between the two groups, like I mentioned, between two races, sexes, or between 2 years. Okay. And then with this 2023 data analysis, we decided to create a topic page on the Chicago Health Atlas. So I give the link here. It's at chicagohealthatlas.org/life-expectancy. but I'll also show you how to get to it from uh, from the homepage of the Health Atlas.
So Bridget is going to be brave and do a live demo for us, show you how they've taken this analysis and put it into action. So she's going to pull that up. And then we've also put the link in the chat. If you'd like to follow along, you can do that live with us as Bridget walks through that. Bridget, back to you.
Thanks. So this is the homepage of the Health Atlas. On the left here, you'll see something that says topic pages and dashboards. And then underneath that is the tab Life Expectancy. So we can open that up. Um, at the top here, we have the conclusion of our analysis from 2023. So we had essentially found that inequity in life expectancy persists in Chicago, despite consistent citywide progress since 2021, since the COVID pandemic, but that these inequities persist in Black Chicagoans and specifically from deaths from chronic disease, homicide, and opioid overdose, and that it's also particularly among residents who live in the near south, west, and far south regions of Chicago. And so I'll show a bit more about the all the data that went behind that conclusion. So to start on this topic page, we have life expectancy starting at 1970 and over time. This allows us to look at even broader trends over time in Chicago. So uh, we would expect, life expectancy to increase overall year to year due to better disease control measures, but also broader access to resources such as food and healthcare, and just overall increases in quality of life, all of which are associated with higher life expectancy. And in this most recent decade, from 2010 to now, um, we have only seen that 0.7 year change from 78 to 78.7 years. And obviously, a large part of this is the COVID-19 pandemic. You can clearly see the largest single year decrease in life expectancy. But also, we have found that the opioid crisis has been a hindrance on progress, particularly pre-COVID. And then beneath this part of this graph, we have an interactive graph directly from the Health Atlas that shows life expectancy over time from 2010. So you can see the same trend, but you can also go over here and click on different stratifications. So we can look at that race ethnicity graph I was showing earlier, and also life expectancy over time by sex. So, you can see that the trend is similar for other places in the US where males have lower life expectancy than females. And then beneath there, we have a couple of drop downs where we have some major disparities we've noticed from our analysis. So I've mentioned already the 10.6 year difference between Black and non-Black Chicagoans, but we also saw a 20.7 year difference between the community area with the highest life expectancy, the Loop, and the one with the lowest, West Garfield Park. And then also geographically, we just have a difference between regions or healthy Chicago zones. So between the highest north central and lowest near south, there's a life expectancy of 9.5 years. And then each of these has drop downs where you can get some more data. So if we open up the Black non-Black life expectancy gap, we can see life expectancy over time, which allows us to look at any differences in trends. So one thing you'll notice is that, like I said, we expect life expectancy to increase over time. And there was some of that to some extent in non-Black Chicagoans, but actually for Black Chicagoans, life expectancy before 2020 was already decreasing. And again, that's in large part due to the opioid crisis. In recent years, we've seen better progress, and we hope to continue that. But by 2023, there's still that 10.6 year gap with the underlying cause of death breakdown on the right. And then I've broken it down a little bit further with breaking out certain chronic diseases that were major contributors to this gap. So I list the top 5 we found here. So number 1 was heart disease, at 1.9 years. But then after that, homicide also at 1.9 years, then opioid overdose, then cancer at 1 year, and then number five is stroke and other circulatory diseases. And so each one of these has a drop down, but I'm just going to give you the one example of opioid overdose. So you'll be able to see opioid related mortality rates by race ethnicity and see how Black Chicagoans, their opioid overdose rate was 4 times that of other race ethnicities. Opening up the drop down that shows life expectancy by community area, we can see maps of life expectancy and all-cause mortality rates with West Garfield Park in red and the Loop in blue. And you can hover over to see how, or see the life expectancy for each of these community areas. So West Garfield Park in 2023 had a life expectancy of 66.6 years compared to the Loop at 87.3. And then we have identified in our strategic plan, as Darlene mentioned, 5 priority community areas. Those are outlined in yellow, and you can see they all had a life expectancy under 70 years. And then this gap is also further broken down by cause of death. So just the comparison of opioid overdose. Oops. Uh, you can see a map of opioid related mortality rates by community area. And we found that West Garfield Park had 10 times the rate of fatal opioid overdoses compared to the Loop. And then lastly, by regions, we found a 9.5-year difference. So you can see this again broken down by region of Chicago outlined in various colors. So the North Central was the highest at 82.6 compared to the near South at 73.1. And you can see how the West and South regions had the lowest life expectancies. And then beneath that, we have some further resources. So some previous reports on life expectancy and also the strategic plan that has been mentioned. And then some more information on our sources and methods. So this is our topic page. We created this topic page to show how we use life expectancy data to get an overall look at the health of Chicagoans, and shows where we can focus further efforts as well. And then I think also this topic page allows us to get that to a broader audience, such as you all.
Thank you. It's so impressive to see all of this come to life and that it is available to the community at the Chicago Health Atlas. We have a couple questions for folks who have participated. If you want to ask any questions, go ahead and put them in the chat. One of the ones that came up earlier was, now that you've been able to pull apart the life expectancy and look at the drivers in the different populations, how have you used that then to tailor your intervention? So now that you have this analysis, how are you taking that forward?
Yeah, that was a big part of the Healthy Chicago 2025 strategic plan. So, like we were mentioning, using the life expectancy data results, the health department was able to prioritize community areas. So they chose the 5 community areas to really focus efforts in. And so I gave the example of the Play Streets initiatives. In previous cycles, that intervention had uh, taken place across many community areas across the city, and it only focused on creating like a safe event in a community so kids can come play. But once we understood that chronic disease was the largest contributor to the racial life expectancy gap, then the intervention was, tailored to be like, hey, let's couple heart health education, include some physical activities for both children and adults, and not have it across the city, but in 8 community areas where we could see that chronic disease related health outcomes could be improved. With the 2023 data brief that was just released, now we see that 2 other community areas, Burnside and Fuller Park, also have some of the lowest life expectancies in the city. So now that can help inform maybe expanding the priority community areas to include the original 5 priority community areas and the top and the new 2 new ones of Fuller Park and Burnside. That's another example. And then another example is really getting involved or participating in chronic disease related events that revolve, like one was like a heart healthy conference that we provided information at and an infographic on the data and resources for participants to go to. So like now we know what we're getting a better understanding of honing in particular areas. And a next step is to look at life expectancy, not just by race and ethnicity, but race and ethnicity and sex to continue honing in on specific areas and populations.
And somebody was curious, with all this great work, what kind of feedback are you getting from the communities with the lowest life expectancy?
So, right, I'm going to be fully transparent. We are the epidemiologists in the Office of Epidemiology. Our wonderful collaborators and partners over in the Inclusion, Diversity, Equity, and Access Bureau, they do a lot of the outreach with the community. So I will check in with them to get a better answer.
And then there's a lot of questions in the chat about some of the data that you were using. I don't know if you can answer all of these, but let me give a go. I think there's a lot of conversation about the mortality data that you used. So one of the questions was, are the mortality data located by addresses of the decedents?
Yes,
Yes.
yes, yes.
And um, are these data publicly available, geocoded through IDPH?
Not publicly available, no. Um, there would likely have to be a data request for something like that.
Okay, because somebody else asked, can anyone access the geocoded mortality data for research? But you would have to make that
Mhm.
request.
Yes.
Okay. And then there was one other question that was really interested, and I know that we run across this from time to time. Zip codes were developed not by population, just by mail, how far the mail guy could walk, basically.
Mhm.
And so there was a question then that is a common issue outside of Chicago. So I don't know what experience you have with this, but that death data is only for the county, and there are some zip codes that go between counties. And I don't know, have you guys done any of this work with Cook County, or do you have any, does anyone have any resources on how to address the issue of the data that goes across counties, but is a zip code data?
Yeah, I mean that's something we really struggle with. Our community areas are based on census tract, so that is all within the city, and there's no overlap. But when we do work with data with zip codes, that is an issue we have. But yeah, we don't have a great way to translate zip codes into census tract or into to know exactly how to break that up.
For sure. I know you want to, we're getting close to time, so I want to make sure, because as you all know on the phone, this takes a village. This is really a brain trust at CDPH. We're really excited about the work that they're doing. So let's make sure we do the acknowledgements and give that toolkit one more time before we wrap up.
Yes. Yeah. Yeah. I just want to give a general shout out to the Life Expectancy Method Working Group, but also a really special shout out to Dr. Emma Boylan. Her work was absolutely crucial to making this happen. So, yes.
And then if you go to the next slide, I will also, Metopio often has clients across the country who are doing amazing work like this. And so we've provided you here with the life expectancy page if you didn't follow along, as well as CDPH's toolkit. And we often host webinars like this on topics that are important to you. So if there are any topics that you'd like to know about before you check out today, put those in the chat, but we will definitely keep you posted. I will just say we are anxiously awaiting the ACS data is still slated to come out December 11th. So we're waiting for that to come out, and our data team will dig into that to see if that is longitudinal data or if any changes has been made. We usually get that turned around in about 24 hours. So that's the next big data release we're looking forward to see how things have changed over time. So just really want to thank Darlene and Bridget for joining us today, for all of you for taking time out of your day, and look forward to seeing you on our next webinar. Thanks so much, everyone.
Thank you.
Thanks.